Hey, all right, Anne, we're so happy to have you and thank you for being here and sharing your information. And we will turn the time over to you now.
All right. Well, thank you. I'm excited to be here talking about long-term care. So a lot of times when we start getting involved in long-term care, assisted living, skilled nursing facilities, it feels like a maze and you don't know which way to go. And so today we're going to give you some information to help you navigate this world. We are going to talk about many environments where seniors and disabled adults receive care, and that will include things that are not assisted living and skilled nursing facilities. And that's because individuals come in and out and back and forth. And so I wanted to give a kind of a broad overview but we will be focusing on the assisted living and skilled nursing facilities. So we'll be talking about short-term acute medical care facilities and then residential options as well. And then for each type of care that we're talking about or environment, we'll look at these different characteristics. So we will jump right in and talk about short-term type of settings. And so you're familiar with emergency rooms and hospitals. This would also include inpatient psychiatric hospitals, and these could be for all adults or specific for geriatric or senior populations. There are other facilities called critical care hospitals or long-term acute care hospitals. And these are different than what you're familiar with in the regular hospital. The acuity is still very high. It's more like a hospital type of setting in terms of the number of nursing staff and the specializations that they have, but people are not quite as critical. They're not going up and down quite as much. And these facilities often focus on things like ventilator and trach care or wound care. And these are generally separate facilities from your regular hospital, and the benefits are different than what you would get from your insurance. Like your insurance may have a specific uh, part of their plan that covers these facilities. And then there are also inpatient rehabilitation hospitals. So this could be a specific unit or perhaps floor within a regular hospital, or it can be a standalone facility. And these facilities are different than the rehab settings that we're going to talk about in a little bit for skilled nursing facility, because they're pretty aggressive in terms of the rehab. People that are in these facilities they have several types of therapy every day and quite a lot of hours. And many of our seniors and disabled adults are able to meet those requirements, but sometimes it's just way too much and it tires people out. And again, this is a separate part of many people's insurance plans, number of stays or number of days that they can be in this type of hospital. So in these facilities, the issues that are addressed are acute medical and mental health issues. They're licensed by both federal and state entities, and people can stay in these facilities sometimes just an hour or a couple hours, like the emergency room, or days or weeks, but they're never intended to be a long-term or permanent placement. The payment sources are private insurance, Medicare, Medicare Advantage plans, and Medicaid. And the staffing, there are always like 24/7 nurses on staff, certified nursing assistants. A lot of times the physicians are available 24/7. Sometimes they are on the site that often, but the physician involvement is pretty robust. And then they don't have other entities coming in. So for instance, if somebody's in an inpatient rehab hospital, home health or hospice would not come in and provide additional services because the facility itself can provide everything. All right, now we're going to talk about the other end of the continuum, and these are residential options. So this would be in addition to somebody's own home or apartment where they've always lived. You will find 55 and older communities. So this could be a specific apartment complex, or it could be a neighborhood or a subdivision that is just 55 and older. Senior housing is often talked about, and this generally means a low-income apartment complex that is specific for seniors. And then there are independent living facilities, or they'll say we're an independent senior living facility. And we'll talk about these more in depth later on in the presentation. But these are just some of the other residential type of options that are more specific for seniors and disabled adults. And in these settings, people may have chronic and mental health issues, but it's not required for somebody to have any kind of specific diagnosis or anything like that. These facilities or entities are not regulated, and the length of stay, if it's especially an apartment setting, the contracts are usually months or month to month, and people stay in these months or years. The payment source is private pay, or there may be some Section 8 or low-income housing options. And if there are any staff in these settings, they don't provide any kind of personal or medical care by the staff. But living in these facilities, you can have home health, traveling physicians, hospice come in and provide services in the home. All right, so those are kind of the two ends, and now we're going to talk about what's more in the middle, the licensed facilities. And there's quite a variety of types of licensed facilities out there. And on the right-hand side, I've listed some of the names or the types of names or things that they would be referred to. And we'll go into each of these categories separately. So the first one is intermediate care facilities or group homes as well. And these are generally for individuals who have developmental disabilities. Now, they can be for people of all ages. There are many people in these facilities that have been here for a long time, and then they become older, and they are definitely a good option for many people. And then the state hospital here in Provo that deals specifically for people with mental health issues. And in these settings, they deal with chronic medical and mental health issues and a wide variety of physical disabilities. They are licensed and regulated by a combination of state or federal entities. And generally, people live in these kind of for the duration, months or years. The payment sources are private pay, Medicaid, DSPD, which is for people with developmental disabilities. And the staff that's on hand 24 hours a day help with things like dressing and bathing. The state mental hospital, they're kind of a different entity, so they may have some different things going on there. But in the intermediate care facilities and group homes, the people can go out to physicians' appointments. There's a lot of traveling physician groups that come into facilities like this, but generally there's no nursing staff or physician staff on hand 24/7. So my program, the Long-Term Care Ombudsman Program, does not go into these facilities, but there is a state disability ombudsman available to help with any problems in these settings. All right, now we're going into the area that's more of my specialty. And so we're going to start talking about skilled nursing facilities. And we're going to divide that up into two different areas. So the first thing we'll talk about is a short-term rehab stay. A lot of times individuals will be living in their home or in the community and have a medical event and need to go to the hospital. And then whatever happened, they're just not able to go back to where they were living before. And so often they will go into a nursing home or a rehabilitation center for a rehab stay. And the expectation is that this would be a short-term stay until they could get back to where they were living before. So these are all licensed as skilled nursing facilities. There are some facilities that just do short-term rehab stays. Most of the facilities, though, will do both. They'll do short-term rehab stays as well as long-term care stays. And they may have this divided up. Short-term rehab or the rehab unit may be one hallway or one wing or a certain area of the facility. And then the people who are staying longer term could be in a different area of the facility. That's pretty common, but not required. In these short-term rehab stays, whether it's a facility that does short or just a facility that just does short-term, the issues addressed are really focused on the short-term medical conditions, a variety of medical and mental health issues, physical disabilities, and many types of dementia. And these facilities are licensed by federal and state entities. And people stay in these facilities for days or weeks. The Medicare benefit specifically has a maximum of 100 days or less. And so that's generally the maximum kind of short-term type of stay that we're talking about. The payment sources are Medicare, Medicare Advantage, private insurance, and community Medicaid. And what I would say is a lot of times the insurance or the payment source is the one who dictates how long the stay is. And it could be very quick, like it could be a couple days or a week or something like that. So if a person is in a short-term rehab stay, then just be prepared to be making decisions very quickly and that things are going to go fast. What I would also say, especially if you have Medicare or Medicare Advantage plans, is if you are told that they are no longer going to pay, that their coverage is ending, you do have appeal rights. And we always encourage people to, if they don't feel like they have met their goals and are ready to go back, to go ahead and go through the appeal process. You may get 1 or 2 extra weeks, and that could be enough to make a difference. So I can give you more information about the appeal process if you need that in a specific situation. Now, in these facilities, they have staff on site 24 hours a day, and they can help with all types of activities of daily living, dressing, eating, toileting, all of those things. And they are required to have a nurse on staff 24 hours a day. In terms of the medical providers, like the physicians, these are not on staff very often, or like they're not on staff the full day. A lot of times they have visiting medical providers come into the facility several times a week, in fact, or the individual can go out to their own medical provider or their own specialist for the appointments. Now, let's say a person has come in on a short-term rehab stay and they just aren't able to return to where they were living before, and they need to stay in a skilled nursing facility long-term. We definitely see that happen quite a bit. There are also individuals that are out in the community and things are not going well, and they need to come into a skilled nursing facility, but they don't have a medical event where they need to go to the hospital. They can come directly from the community, and what we recommend in those types of situations is to reach out to find the facility that you want. Once you've chosen a facility, to reach out to their admissions director, and they can help you in terms of knowing what paperwork you need and what connections you need to make in terms of making that transition or that admission process. So if a person is in a skilled nursing facility for a longer term, then the emphasis really changes from getting better and working with therapy and improving to making this a home. So what activities do they want to be involved in? How can we set up their home to make it feel like it's their space, very home-like? And how do they want to interact with the other residents or the staff and really become part of that community? When a person is in a skilled nursing facility, the expectation is if they do have to go back out to the hospital for a medical event, that when they return, when they're stabilized from the hospital, they should be able to come back to the same facility where they were at, because that is their home. And people do, they're in skilled nursing facility, they go out to the hospital, they come back, sometimes many times during their stay. And in this setting, the issues addressed are those chronic medical and mental health issues, a variety of physical disabilities, and many types of dementia. They are licensed and regulated by the same federal and state entities, and length of stay can be days, weeks, months, and often years. And then the payment source for this type of stay shifts. People pay privately, or Medicaid can help with their stay. And I'm not going to go into Medicaid too much, but I will point out that in order to stay in a skilled nursing facility under Medicaid, a person has to meet two types of criteria. The first one is financial. They need to have a certain number of assets and a limitation on their income, but they also need a level of care eligibility. So they need to show that they need care with things like toileting and dressing several times a day, and this is an ongoing need. So we often see people that don't quite meet that level of care eligibility, and that can be kind of a hard situation to deal with. But this is what Medicaid does, and they look at it on a quarterly basis to make sure that the people that they're paying for in a facility really do need that level of care. And then the type of staffing in these facilities is there's 24-hour CNAs on hand to help with all those ADLs, or activities of daily living, and a nurse is required to be on staff 24 hours a day. And then in terms of the physicians or nurse practitioners, that's the same as we talked about before. They can use the ones that come into the facility, or they can go out to their own providers. Now, one unique thing about this type of level of stay in a skilled nursing facility is that they can receive hospice services. If somebody has a terminal diagnosis, these can be in addition to the services provided by the facility staff, and can be a good benefit in the right situation. All right, now we're going to talk about assisted living facilities. So these facilities are regulated and set up differently, but the emphasis in these facilities is on quality of life. They have generally their own type of, it almost looks like a studio apartment, or even some of the facilities you can get 1 and 2 bedroom apartments. And so setting them up in a home-like situation, and then focusing on relationships with other residents. And what I will say is that there is a huge variety in terms of assisted living facilities, both in size and in price point, and the types of services and things that they provide. When individuals are living in an assisted living facility and they have to go to the hospital, the expectation is that they should be able to return to the assisted living facility, because that would be considered their home. Just like if I went to the hospital, my expectation is that I would go back to my home. We do see residents that will be at an assisted living facility, go out to the hospital, and then perhaps they'll have a short-term rehab stay before coming back to the assisted living. And that's actually pretty common. Assisted living facilities, the issues addressed are chronic medical and mental health issues, again, a wide variety of physical disabilities, and many levels and types of dementia. The licensing is different because there are no federal licenses or regulations about assisted living, but they are regulated by the state and surveyed on a regular basis. The length of stay is generally month-to-month types of contracts, and people will stay in these facilities for months and often years. The payment source is private pay. There is a Medicaid program called the New Choice Waiver Program that can pay for assisted living facilities. Not all assisted living facilities have this program, and there is a link at the end in my slides to information about this specific program. What I will say about the payment in terms of assisted living facilities is expect the rates and the prices and the structure to change. And we as ombudsmen don't try to keep track of what different facilities pay or how that payment structure is changed, but we do know that that changes over time. So if you go in knowing that it's one price, just expect that that's going to go up or change over time. The staffing in these facilities, they do have CNAs or staff on hand to provide help with those daily living activities, but a nurse is not required to be on site 24 hours a day. And in some of the smaller facilities, they may be only there for a couple hours a week, they do have to be available 24 hours a day to the staff in the facility to ask any of those types of medical questions. And in terms of physicians, nurse practitioners, things like that, we have many traveling groups that go to these settings, but individuals can also go out to their own appointments. Since it is considered a home or a community-based setting, hospice and home health can come in and supplement the services that the facility staff are providing to the residents. All right. Now, the term independent living facility or independent assisted living facility is out there, and there's a lot of variation and confusion. So I thought I would talk about these a little bit more in depth. So there are some, I would say, apartment complexes that describe themselves as independent or senior living facilities. And so these would be like a standalone apartment complex that is focused on seniors or disabled adults. They are not licensed as assisted living facilities, but they may provide like a group dining setting, housekeeping, transportation, and activities. But the facility staff should not be providing any help with medications or activities of daily living. If somebody needs those services, they can be brought in like with home health or hospice, but the facility staff does not provide those. A different variation is you will have on one campus or one entity that there will be both an assisted living building, or maybe within a building, there's one part of the building that is assisted living, and then maybe another wing or another section that's just independent living, or they may have separate independent living apartments or cottages on the same campus. And the individuals who are in the independent living sections can come over to the assisted living facility and participate in the dining. They can also participate in the activities. Maybe they get transportation help. Maybe staff come over and do some housekeeping in their individual units. But again, the staff at the assisted living facility should not be providing medical care or any kind of personal care to those individuals. So the parts that are independent are not licensed, but if there's an assisted living building or part of a building that is assisted living, that one would be licensed and go under the regulations that we talked about. And then kind of a third variation is you will see a building that says independent assisted living facility. And so in this building, the whole facility is licensed as an assisted living facility, but individuals in the facility may not be needing the personal care that is available. And so think of it as people come in as an independent rate, like they only need the group dining, they only need the housekeeping, but they're not ready to receive the personal care services. And so they kind of have that base rate, that independent rate. They may call it something different, but they individually are independent. The advantage of this type of facility is as somebody declines or changes, different services can be added on top of by the facility staff. You'll have to pay more for those, but a person doesn't have to move from one type of setting to the other to get those additional services. So the independent and assisted living facilities, there's a lot of variety out there, and it can be kind of confusing. If you have any questions about, is this facility licensed or it is not, the ombudsman are a resource that you can always call and ask. All right, some general things about assisted living facilities and their level of care. And Utah has set it up so that there are 2 levels of care within the assisted living environment. And I will say many of the assisted living facilities in our area do level 1 and level 2. There are some that just do level 1. And so that's why we're going to tease these out a little bit. If somebody is in a level 1, they need less help, to think about it that way. And these are some of the requirements. If there were some kind of an emergency, they need to be able to get out of the building without help. So let's say there's a fire drill, and the staff go around and are saying, there's a fire drill, we all need to get out to the front lawn. An individual may be able to walk out there with them on their own. Maybe they need a walker. If they use a wheelchair, they would have to be able to get in and out of their wheelchair without help, and then be able to wield the wheelchair on their own. And that could be a power wheelchair or a regular wheelchair. And they can only need assistance with 3 ADLs. Those are the dressing, toileting, that kind of thing. An individual in a level 2 facility is able to receive a bit more help. So again, let's go back to that fire drill explanation or example. The staff would be able to come in and help an individual maybe get out of the bed and into the wheelchair, and then the staff would be able to wheel them out of the facility to the evacuation area. They can receive assistance with more than 3 activities of daily living, but the facility has some discretion in terms of kind of the ceiling or cap. So for instance, I know of one facility in our area that they provide assistance with lots of activities of daily living, but in terms of feeding or eating, they may be able to help cut up, like if it's a piece of meat, they may be able to cut it into bite-sized pieces or help somebody open a package, but they do not have staff on hand to help take the food, put it on the fork, and then actually put it into somebody's mouth. So they have decided that's a level of care that they don't want to provide. And then all facilities have these limitations within the regulations. So they cannot use mechanical lifts. So this would be a Hoyer or a sit-to-stand machine. If somebody's not able to transfer without these assistants, they really have to go to a different level of care. That would be a skilled nursing facility. And then the staff on hand cannot administer insulin or injections. Only a nurse can do that. And again, because they're assisted living, they're not required to have a nurse on hand all the time. In these situations, if the resident may be able to do the insulin themselves, or maybe there's family members or home health agencies that can come and do with this, the facility nurse can choose to do that, but often they don't, just because that becomes every day, a couple times a day kind of commitment. And a lot of times the facility nurse just doesn't want to commit to that kind of schedule. So we do see individuals that are in assisted living facilities that get to a point where their level of care is above and beyond what the facility is allowed to provide. And then they need to move to a skilled nursing facility. Sometimes hospice can be involved so that transition doesn't happen. And so every situation is different. All right, now we'll talk about memory care units or facilities. And an assisted living facility or a skilled nursing facility can have memory care within their facility. There are a few facilities that are memory care only. There are other ones that within their facility, they will have a wing or a hallway that is designated just for memory care unit. And when I'm talking about memory care or secure units, I'm talking about a unit or a facility where in order to get in and out, you have to use a number pad, or maybe the staff has a card that they have to slide or use to get people in and out. It's secure. Now, not all residents who have dementia need a memory care unit. In fact, the majority of them do not. It's specifically for people who have dementia-related behaviors like wandering or other kinds of behaviors. Especially in an assisted living facility, you may find a facility that has that keypad or card that needs to be used to get in and out of the facility. But not all of the individuals in this facility or that unit need memory care. They may be there because they need a higher level of help with ADLs. And so those residents can go in and out. Sometimes they'll have the code to be able to go in and out on their own. In general, the memory care units address people who have that dementia diagnosis and then those dementia-related behaviors, but they can also have chronic medical and mental health issues and a wide variety of physical disabilities. The type of licensing or regulation, skilled nursing facilities will have the federal and state. If it's an assisted living facility, they are only licensed by the state entities. And people in these facilities can stay days, weeks, months, and even years. And the payment source would be private pay or Medicaid. For the staffing, they are required to have staff in the facility 24 hours a day. And actually in this unit, the staff have to stay. There has to be somebody in this unit every single moment. So even a break or something like that, the staff, they have to trade off. So there's always somebody there to help with those ADLs. In terms of a nurse, if it's an assisted living facility, it doesn't have to be on site. More than just a couple hours a week would be the minimum. And if it's a skilled nursing facility, there does have to be a nurse in the building. If it's a skilled nursing facility where one unit is specific for memory care and another unit is not, the nurse can go back and forth. They don't have to be in that specific unit all the time, but there does have to be a nurse on the campus for this facility. And then, as we've talked about before, medical providers, like the nurses and physicians, they can come in or individuals can come out. And hospice is often used for individuals in these types of units. Some general things about long-term care facilities in general. The individuals that are in these facilities are referred to as residents rather than patients or clients. And let's talk about staffing ratios. So we often hear like one CNA or one nurse per 10 residents or per 20 residents. Utah does not have any regulations that have a set staffing ratio for skilled nursing or assisted living facilities. And the federal government does not have any staffing ratios for skilled nursing facilities at this moment. It is something that you're certainly welcome and encouraged to ask the staff about as you're looking at facilities. What kind of staffing ratios do you have? And some facilities will have that information readily available and tell you what that is. If you are looking at skilled nursing facilities, every skilled nursing facility is required every single day, weekends included, to post a sheet that says how many residents are in the facility, and then it will have the total number of CNA hours and the total number of nursing hours. And you can use that to compute a ratio. Even though there's not a regulation about what that should be, there are some guidelines about what they are. And this poster should be available and accessible to anybody. You're certainly welcome to ask the facilities where they are. A lot of times they're somewhere near the front, maybe by the receptionist's desk. And that's something to look at as you're making decisions. The regulations do say that facilities are required to meet resident needs, but that's pretty open to interpretation. And so just a lot of things that can go into that or are not included in that. And let me just say that all of these facilities, the skilled nursing and assisted living facilities, they really have two types of philosophies that are going on at the same time. And there's some inherent tension in that. And so there's the kind of the medical model as well as the community or residential model. And so let me give you an example of that. In a medical model philosophy, if somebody has diabetes, the emphasis would be on keeping those blood sugars really stable. Medications, insulin, very strict diet restrictions. The goal is to keep them as medically stable as possible. Whereas the community or residential model sees diabetes as one part of somebody's life. So just as somebody living in the community, they can choose, do I want to be really strict about my diet, or do I want to be really strict about my diet except on Sunday and that's the day I'm going to have dessert? Or maybe I'm going to do my best but not be as strict. Or sometimes people just throw the diet out the window and say, if I go over, then I'll use the insulin and make it up that way. And so a lot of times we have this tension between what the medical model or the medical professionals see as best practice, but then what do people really want to live like? And there can be some differences of opinion there. Sometimes that's between the resident and their family, or the resident and the staff, or the resident and the medical providers that are interacting with them. And so that's just something to keep in mind is what's the goal here? What am I really looking at? So this is a map of all the long-term care facilities in our area. You can see there's a lot of variety in terms of the color, and they're spread throughout the area. And then these are some resources. So the first one talks about if you have Medicare or a Medicare Advantage plan, this talks about the skilled nursing facility benefit, what is included, what the requirements are. The next one down is a site on the Medicare Compare Nursing Home. If you're trying to decide which facility is better, it does give a star rating. You can go in and put in your like your city or your zip code, and it will give you several facilities in the area. This is based on the survey data, and the survey is done once a year. Sometimes the information can be a little bit out of date, but it is a good resource to get an idea of which facilities are better or worse than others. The third one down gives basic information about the financial eligibility for Medicaid. And then the New Choice Waiver Program, that is the program specifically for assisted living facilities and that Medicaid pays for. The next one down is the link to that map that I just showed you. And then the second to last one, if you are looking for an assisted living facility, the state of Utah does not have any type of rating system, but you can go in and look up their survey data. And this started in October 2023, and it's just a really helpful place to go and see what things they've had problems with in the past. And then the last one, this is a resource put out, and it is useful for nursing homes and assisted living in terms of how to resolve problems if you're involved in one of these settings. And then this is my final slide. So as long-term care ombudsman, we visit all of the licensed facilities quarterly, and many times we visit them more than quarterly. And our role is to advocate for residents with their consent, but we can also work with family members. And our focus is on quality of care, quality of life, resident rights, and discharge issues. And if you or your loved one has any concerns about these issues, or facility staff, or a community member, we can take calls and referrals from all of those entities. If you are trying to find a facility and want information, we can give you lots of information, but we do not refer or recommend any facility over another. And anybody who does call us, we have very strict confidentiality rules. We would not share that with anybody unless we had permission from the resident or their family member to move forward and address a problem. And then if you have any questions or concerns, we are happy to speak with you. That is really our other role, is to provide a lot of information to the community. And here's my telephone number and my email address. And at this point, we're going to end the recording, and I look forward to speaking with you.
Hey, thank you, Anne. Thank you so much for your presentation. That was great. So much information. I'm going to